Forum, Empowering Global Supply Chain Opportunities. We're joined by none other than Senator Datuk Ras Adiba Radzi. Thank you, Datuk, for joining us today.
Thank you for having me, guys.
Of course, we appreciate your time, and we appreciate you dialing in. I know you've got a very busy schedule and a very busy, a very heavy workload on you during the pandemic. But one of the things that we wanted to discuss with you is an issue that is faced by a lot of people, which is employment. But I think it's also an issue that's faced directly and in a more acute manner with the disabled community. So I wanted to ask you straight away, what is the situation now for people with disabilities in Malaysia?
Well, as in during the pandemic or just in general?
I think we could go both, Dato', really.
Okay, well, it's pretty tough right now. Just as everybody else, we are going through something that we never thought that would ever go through. I have to be very honest with you. Even before the pandemic, it has been pretty tough for us all, especially to get jobs and stuff like that. So now with what's happening right now, we find it even tougher, especially my friends who are blind. You know, they're unable to go out and try to make ends meet because they can't sell tissues, they can't sell, they can't, open their massage centers, and my other friends who cooks from home and stuff, so that it's difficult for them to move out because first they can't afford it to buy the things, and even if they get to buy some things, they're not sure whether people are able to come out to buy even nasi lemak from them. So it's very trying, but I tell everybody that, that we need to keep our heads and our hearts together, and just focus and move forward. And I tell them all that everybody's going through this. This is something that no one knew was going to happen, not just here, but across the world. So really, the going gets tough, the tough gets going. But this time around, it's not just the money that we're thinking of, that, it's not just economically, but also mentally. It's affected a lot of people, and for persons with disability, it's even worse. We are getting a lot of reports. A lot of people are just losing it, and sometimes in a home, we have about 4 to 5 people, 4 to 5 children who are disabled. So the parents themselves are, finding it hard to cope, trying to feed the children, and then the children are not able to go out. So there's a lot of problems inside the house. And I just give you a case where this this deaf couple with 3 of their children. Their children are the ones that helps to sign and for people outside to correspond to them. But later on, they found out that the husband, the father, is positive, and they didn't know what else to do. They went out in the car, and they were going everywhere. They didn't know whether they should go to MAEBS or the centers. So in the end, they contacted me via a sign language interpreter. And then after that, they said they need help. They don't know where to go. And I said, okay, fine. We bring you to the clinic and test. So the doctor came and did the testing and everything. So 5 of them went to do the test. The father and the daughter is positive. The other 3, the wife and the 2 other kids, are negative. But they have another problem. They're staying in a flat which only has 1 room, and the toilet is a shared toilet outside. So things like this, and not being able to communicate because of the different kinds of disability that we all have is also very tough. Yesterday, I received a call from a blind deaf girl, and she is panicking because she cannot hear what people are saying in the loudspeaker, and she can't see because 90% of her eyesight's, gone, and she's begging me. She says, please help me. She says, I'm having fever. I don't know who to ask help. Everybody is sick and ill here. I need water. I need to drink. I can't go to the washroom. It's too far, and I have to line up. I don't know where to go. So she says, could you please help me get me into hospital? So I was frantically trying to get everybody as well, to see whether there is one bed. So things like that. Thankfully we managed to get her into hospital. So she's a bit calmer. But I have to be very honest with you. I mean, I don't know how this is going to be. For everyone else, it's tough, but for persons with disability, it's even tougher.
Someone just asked, what's the biggest concern? And I think you've listed a few large concerns. My concern as a kind of communicator is it's very difficult to communicate to everybody at once. If people who are blind, people who are deaf, how are we addressing that issue at the moment? And how is the community coming together to deal with this issue?
Well, first and foremost, there are only very few people who can communicate with somebody who's deaf-blind. Because, see, the person can't even see, and the person can't hear. So you just have to open the palm of their hands and you just have to sign A, B, C or something like that. And then if there is food or anything, they use other senses. So that's already a problem in itself, because not everybody is trained to communicate with them. I know someone who is deaf who's been trained. He's from the Malaysian Federation of the Deaf, MFD. He's been trained to communicate with the deaf and blind. And then I know of two others who's an able-bodied who's able to assist. But this is a really big hurdle for us, because we haven't gone there. I think it's not just us, but most places around the world, we still don't have enough experts who can handle persons with disability, who has two disability, deaf blind. It's very lonely being a disabled, but it's more lonely when you can't see and when you can't speak. Having said that, I have also friends who, when you speak to them, they cannot communicate with you, but they're able to understand bits and pieces. So I always tell people, you know what, you cannot solve all the problems for everybody, but what you can do is try to assist one person at a time in your own ways. So everybody, right now, we need to be there for each other and be each other's eyes and ears. And however hard it is, we must reach out and tell each other, it's okay, you're not alone. Let's do this together. I don't know what goes on in your mind. I don't know what goes on in your heart or even in your house, but I am here for you. And if you need help, let me just try and see how best I can help. So I tell people not to just depend on the government per se. Yes, of course, the government is here to assist the best that they can. But I feel that this is the best time for us all Malaysians to come together and be there for each other, not just by assisting someone when they see a white flag, but also being there for someone to just call and find out, to just pass in front of the house and wave and say, are you okay? But Nordin, another thing that is on the rise is also actually problems, marital problems. You hear husbands being and wives, they have brawls, and there's a lot of violence in the house. So that is something that we need to open our ears, especially when it comes to children and disabled children, just like what happened to this young girl called Bella. And Bella is not the only one. There's so many other children out there who don't have a voice.
Mm-hmm.
You know, we all need to be their voices and listen out.
Mm-hmm.
If you hear somebody screaming, you hear people asking for help, you know, be a nosy person if you like at this point of time, because you have to be, because you don't want to lose anybody. And you know,
Exactly.
if you don't do that, then we're going to lose somebody, and we cannot afford to lose anyone right now.
Mm. No, I like that approach. You know, sometimes it's okay to be nosy, and mental health with normally able people is a huge issue. And one of the things that we've seen time and time again is the need to feel self-worth. And one of the things that I wanted to kind of bring into the discussion now, if possible, was the issues of employment. A lot of companies are not employing people with disabilities, and what needs to change there? The government, I think, has a quota of 1%, if I'm not mistaken,
Yeah.
in the government service. What's the status of that, and where are we going with that?
Well, right now we have already four ministries who have surpassed that 1%. But I have to be very honest, we shouldn't put at 1%. We must, this is 2021, we must already
Mm-hmm.
increase that to 5%. Even 5% is low. I don't see that
Mm-hmm.
as a problem, but in order for us to do that, we have to make sure that we change our mindset and understand one thing: the disabled are actually, that we are part of the society, the community. We are Malaysians,
Mm-hmm.
and like everyone else, we need to work. So the best thing to do right now is to make everybody understand across the board that just because somebody is disabled, that does not mean
Mm-hmm.
that we should push them aside. That does not mean that we should deprive them of working and earn a living and have a family and feel good like everybody else.
Mm-hmm.
So that one has to change first, and then like for us to encourage persons with disabilities, right, to enter the labor market. For everybody's just to give everyone an idea, for some of you who already know, right now government is committed to disburse a monthly allowance of for 150 ringgit to PWDs who are currently working, but with a monthly income less than 1,005. So now that has increased, and that is one of the government's attempt to make sure that we can push the PWDs to the forefront, of socio-economic policies. And the laws of Malaysia's Act 685, Persons with Disabilities
Mm-hmm.
Act 2008, have called for a switch to a human rights-based approach that advocates better provision of employment opportunities and accessibility by employers towards PWDs. With reference to
Mm-hmm.
Section 29 of this law, the allocations and provisions for access to employment, it covers PWDs. It says PWDs must have the right to access to employment on equal basis with persons without disabilities. That means,
Mm-hmm.
you have to be fair to us. I mean, I have friends who's got master's degree and who's got PhD. They come out
Mm-hmm.
and they want to find jobs, and people don't want to give jobs because they're disabled, So
Mm-hmm.
the employers must protect the rights of persons with disabilities on equal basis, just like everyone else, to just and favorable conditions of work, equal value, safe and healthy
Mm-hmm.
working conditions, and protect us from harassment and the redress of grievances. One of the things that we face, I give an example. When I first became disabled, I went
Mm-hmm.
to a job interview, and it was at 9 o'clock. I arrived at 8:30. I arrived at the guard house and I said, I'm here for a job interview. And he says, oh, it's taken already. And I'm like, what? It hasn't even started. So that already
Yeah.
starts from the first gatekeeper already says that.
Yeah, literally
So
the
that will be
gatekeeper. Yeah.
discrimination. So it's very important for the management of the company to explain to everybody, look, each person who is
Mm-hmm.
disabled have their own talents, and each of them have their own skills. Some of
Yes.
them have gone to university and done really well, but some of them, they have other skills. So let's all understand that
Mm-hmm.
no one should be left behind, and we shouldn't discriminate the disabled, because it's not right. And I tell everybody, you know what? Eventually, everyone's going to become disabled one day. So let's not push your luck here. Let's,
Yes,
you know,
you get
let,
old, you get older, and then
yes,
eventually,
yes.
exactly.
You must always have an open mind. So, and so many things actually, like the council shall promote this under the PWD Act,
Mm-hmm.
and the council shall promote opportunities for training for persons with disabilities in the labour market, as well as opportunities for self-employment, entrepreneurship, the
Mm-hmm.
development of cooperatives, starting one's own business, and creating opportunities to work from home.
Yeah.
So, in developing such policies, strategies, and measures, it's possible that we include persons with disability. But having said
Mm-hmm.
that, our PWD Act, Akta OQ 2008, um,
Mm-hmm.
is in the midst of being improved, because for us, as disabled, we feel that there's a lot of room for improvement. So that we have more rights and if say, for example, if someone build a building and the infra
Yes.
does not follow the specs, then we can charge them. They can be penalized. Right now,
Mm-hmm.
there is no such thing as that. So yeah, we need to be
Yeah.
able to do all that. Yeah.
Understood, Dato. And I think one of the key things is when developers start to build new buildings or retrofit old ones, you need to start taking advantage of global best practices. I
Yes.
mean, so many countries have done so much in this area. It's not like you need to reinvent the wheel now. It's not. There's no excuse really. Rosanna has come up with a question, and it's a very interesting question about the OKU card and how people are registered with the government and how the different government departments deal with them. Has everyone been registered yet, and is everyone getting the help that they need?
No. According to United Nations, 15% of the country's population are disabled. So that means we're 32 million. So that's about here and there about 4.7 million of us. The one that's
Mm-hmm.
registered is close to 600,000. So 4.1 million of my friends are still out there. So uh, what Rosanna's asking is, how are we going to be supporting, our friends out there who are not registered and they don't have an OKU
Mm-hmm.
card or a disabled card? Well, this is the thing, we can only do so much, but the family members, the parents, and the disabled themselves, they have to come out. Early intervention is very,
Mm-hmm.
very important. A lot of
Okay.
people don't want their children to be registered because they say, "Oh, we're so embarrassed. Oh, our child is not really disabled." They're in denial, and then they go like, "Oh,
Mm-hmm.
if anything, we can look after the children." So that's not true. That's not true, because if anything happens to
Mm-hmm.
you, how are these individuals going to survive? You need to teach them how to be independent. Now, the welfare department have come out with a lot of independent living training center, where we
Mm-hmm.
teach
Mm-hmm.
them basic stuff so that they can look after themselves, and be independent. I'll give you an example. I'm on a wheelchair, right? If you see me, right,
Mm-hmm.
don't just
Yeah.
simply come and straight away push my wheelchair, because this is the only way that I can move my
Mm-hmm.
wheelchair on my legs. So, when, say, for example, when you see me and you just push me, it's like you're taking away the only thing that I can do. I
Yeah.
mean,
Exactly.
I'm not able to jump around and walk around. So, let's not assume things for us. You must be able to allow us to grow and learn. That's why early intervention is very,
Mm-hmm.
very important. They need to go to special classes. We need to support them. Some of us have disabilities that does not enable us to do many things, but there's still a lot of us who can do many other things. So don't deprive us of that. Don't speak on behalf of us. Don't assume. Allow us to be the best of ourselves in our own way. And grow.
Okay. No, that's an interesting thing, because unless you say you can't understand someone until you walk a mile in their shoes. But in this case, you're in a wheelchair, and some good meaning person might say, okay, let me help push you around. But the English saying "stop pushing me around" is probably there for a reason. So I think that kind of understanding of people with disabilities is probably still got a long way to go. What do you think, Dato?
Oh no, that's very, very true. I mean, like I said, it's how we need to be able to understand first that a person with disability is another human being. We may not be able to speak or understand and move like everybody else, or see or hear, but we have feelings. So you don't assume things for us. So you must be able to understand that we have needs, special needs, but we're also human beings. So people's perception has to change. So I have shared this many times before. I said we need to teach about persons with disability from small, from kindy. You must teach the children. You see, this person is blind, this person is deaf, this person has cerebral palsy or has a rare disease, or this person is under the mental category. But let's understand and support them. So all this we must, because children, they don't discriminate. Just like in the water, in the sea, the fishes look at you. I mean, I scuba dive, and the fishes look at me, and they're like, yeah, right. So, what? So you can't move your leg yet. So what? So we need to do that. We need to do that. We need to teach our children to understand and have empathy, and then we need to also make sure that sign language is the third language to communicate, because we have a lot of people who are deaf, and when they grow up, they're able to communicate with the person who can't hear, and then they're also able to work to become sign language interpreters. So yeah, start from small. Public service announcements, very important, and and have people understand that it's okay not to be okay, and that every one of us have are different, but we all have feelings. So that must be instilled. Empathy is very important. Respect, empathy is very important.
No, I agree, and I think when we go to look at this issue of education, many years ago, in a lot of the developed countries, it was a question of access for people with disabilities to get to these schools, to get to schools. And I think in many countries now, it's like what you said earlier. It's illegal not to give them access to school. What do we need to do here in Malaysia to kind of ensure that there's 100% access to education? And of course, there's a spectrum. There's those who have different disabilities and have different concerns, so they do need special attention. But by and large, is there a group of people who need to get to school and are not getting to school as easily as possible? I mean, in non-COVID times, I'm not talking about now people can just tune into a laptop if they have them. But what are you seeing in the education space, Dato?
Well, first and foremost, it's very important for us to make sure we have our children join the early intervention schools, the classes, because from then on only we can gauge how they are going to be moving. Meaning, are they able to would they have the skills? Would they be able to do this and do that? And how we can support them. But when you're talking about, we talk about lack of education, right? This is what we're talking about, right? Lack of education for PWDs.
Yeah.
Well, children with disability who enrolls in schools, they usually face various barriers accessing a quality education, and inaccessible buildings. Just now I saw, we talk about, I think it was Madeline that asked about effective ways to raise awareness about accessibility and stuff like that. So we have a lot of challenges, and barriers that we go through when we want to go to school. Inaccessible buildings, classrooms and toilets, and lack of aids and other support, known as reasonable accommodations. This reasonable accommodation is a key component of our right to inclusive education. Like accommodations may include hearing aids, braille textbooks, audio, video, and easy to read learning materials, sign language interpreters, instructions for them, structural modification schools, such as we talked about ramps and disabled toilets, accessible toilets and parking spaces and stuff like that. All these things are very, very important for us. And then, like just now, we also talked about special needs children who, say, for example, on the spectrum, you were saying, people with intellectual disabilities often work more concentrated and accurately. I mean, I have a son, he's 14, and he's on the spectrum. So he's an SP. So people who are under the spectrum, they're Asperger, they're often intellectually gifted. They have a quick grasp, high attention to detail, and extreme ability to concentrate, tenacity, and perseverance. So, but we can only have them be part of this education system first if the school is accessible, as in the infra. Second, if we have the support system, meaning the teachers, are skilled. And then third, if we have the tools that we need. Okay. But again, the problem that we often face is, say, for example, if a person is on a wheelchair, why would you want to put that person on the first or second floor? Why can't you bring the whole class down? Why can't you adjust? Simple things, it's whether or not you want to do it. It's I really pity the students, yes, but I actually pity more of the teachers, because I sympathize with them, because they don't have the empathy and they don't see that a lot of people with who's on the spectrum, Albert Einstein, even Bill Gates, all these talented people, they go to school, they're treated like normal, they have they are given the opportunity to study what they want to study. Before this, we didn't. Sometimes if there are courses, they said, "Oh, you can only take courses which is friendly to you," and I'm like, "What is that supposed to mean? Friendly to me?"
Yeah, exactly.
So I'm very thankful that my task force team has worked with the higher education ministry. And they've worked around things, to adjust and to now persons with disability have access to most of the subjects, which is great, because how can you know whether that person is able to do it if you don't give them the opportunity?
Exactly. And I think this is one of the things. It's about opportunity. Now, from a corporate perspective, because we as the Malaysia Global Business Forum, we like to see how corporations can contribute through CSR, through improving HR policy, for example. Is there, if people in the HR department are listening today, are you willing to sit down and with a group of people from the different corporations in the HR department and help them get their HR policies right? Are you willing to help them, you or your team, that is, with improving facilities at the workplace?
Definitely. I wouldn't mind. In fact, I'd love to be able to share so that they can see things in my shoes. I always tell people, when you want to do something for persons with disability for the OKU, don't assume, and don't think you know everything about us, because you don't, so there's nothing about us without us, so if you're doing something that has us in mind, or us in that project, please make sure you have someone who's disabled with us, so it's very important, like, for us to create an inclusive culture, companies that are inclusive of workers with disabilities manage their cultures in all kinds of ways. So you have to, like, nominate a diversity champion and support disability specific resource groups, including senior leadership in messaging and creating awareness and doing all this effort to help underscore the importance of inclusion. And then we must broaden the talent practices. We have to recruit people with disabilities. When you recruit someone who's disabled, your company, you can turn it into a community organization. Hiring initiative focus on partnerships with community-based organizations. Like, now I'm so happy to see a lot of private sectors, corporate coming together and opening up their doors, allowing persons with disabilities to work with them. Of course, each of us have our various talents and capabilities. So, you don't give someone who's on a wheelchair a job to, stack up boxes. It has to be practical. I mean, duh. Like, sometimes people actually do that,
Yeah.
So
My
I'm like,
God.
come on.
This is the only job we have, and not really intelligent thinking
So,
there.
and then you have to, like, prioritize access for everybody, because, like I said, everyone's going to become disabled one day. So when you do a ramp, please don't build a ramp just because you have to build a ramp. You have to follow
Or
the
the steep ramps.
specification.
I've seen some of the steep
Yeah.
ramps.
If you go up
I
there, you
have
come
troubles
down.
walking down them. Yeah.
Yeah, God, you can just fall and die. You must think about yourselves, because sometimes some of us, our knees are weak, and then when you go up steps, right? The bars where you hold, right? If you notice,
Yes, the rails.
there's a top, the rails, and then there is another rail underneath. They said, oh,
Yes.
that rail is probably to support the top rail. I said, no, that one is for children. So when they walk up,
Yeah.
they can hold on to it. And they're like, oh, really? I said,
Wow.
yeah. And then, like, like, sometimes when they build washrooms, for persons with disability, or even people who have rare disease, they're unable to walk like normal. They cannot sit on a normal throne. So you need, to use the disabled toilet. You must also make sure that when I go in the toilet, I can close the door. Sometimes I go in the toilet with my wheelchair, I can't close the door, and I'm like, okay, how am I going to do this again? And they say, oh, it's okay.
Exactly.
You don't have to lock the door. And I'm like, how is that? And then
Right.
there was one time when I went into the toilet and I wanted to use the toilet, and I suddenly heard somebody snoring, and I'm like, okay, where did that come from? And then I hear, I see a lady who is lying down. It was the cleaner, and I said, excuse me, miss, excuse me. I was like, I need to go to the loo. Yeah, I need to go to the loo. And she said, oh, you can go ahead. It's okay. I'm used to it. And I'm like, you're used to it. I'm not.
Oh my God.
Yeah, it takes all sorts. It takes all sorts,
Amazing. Yeah, I know you've got some. I'm sure there's a lot of crazy stories you're going to be able to tell us. We're coming up to the end of our session, but Zuleika asks, what business opportunities can disabled persons pursue after they spend some time in the corporate world? What do you see as a kind of is it self-employment? Is it entrepreneurship? Is it getting into the corporate world? Where do you see us going from here? And kind of, we talk about small steps. We talk about getting things done one step at a time. But what should we do after today? What should corporations do? What should individuals do moving forward and starting to get this equation right?
Well, first and foremost, we should understand that persons with disabilities just like everyone else. And, you know, having been in say, for example, in the corporate sector, when they come out, they can excel. I tell my friends, the sky and the sea is the limit. And, you know, your disability is actually your ability, because what we have, other people don't have, you know. And, but the most important thing is, first, society has to understand that the thing that is making us disabled is not us. It's the things around us. It's the society that's making us disabled. It's the environment. You know, we can adjust, because you know, like, what you don't know, you don't care. You know, if for some of my friends, they're not able to hear, they're not able to see, they're not able to move, so they couldn't be bothered with whatever that they don't have. They want to work and they want to reach their goals. So it's not us that's making us disabled, it's things around us. So it's very important for everybody out there to give an opportunity and be fair to persons with disability. We all have our talents and our skills, not the same like you know, a person who's able, but some of us have even more qualities, you know, more talents than other able-bodied. You know, I would like to have everyone understand that just because we're disabled, that does not mean that we cannot be better than you, because no one is indispensable, and no one can tell us and judge us that we cannot do this and we cannot do that. So I get really irked, I get really upset when I have friends who've come up the corporate ladder, and you know, they because of their experience, you know, they should be up there, but they're not given that opportunity because people discriminate and say, oh yeah, but he or she is disabled, you know, like, we don't want them to bother, we don't want them to, you know, susah dia nanti, you know, it's so difficult for them, you know, like, you know, it's cumbersome, can they do this, can they do that? I'm like, who are you to tell us what we can do or we cannot do? You know,
Exactly.
we can do.
Exactly.
You just have to, you know, see us like everybody else. You know, maybe we don't look the same like you, we don't move the same like you, we don't speak, we don't hear the same like you, we don't communicate the same like you. You know, but who are you to judge us? Don't. So please don't. We must be able to open our hearts and open our minds and just accept persons with disability as they are, accept their skills, you know, accept their experiences. You know, if they are doctors, they have master's degree, diploma or degree, or any vocational certificates and stuff, so that give them that opportunity. You know, I mean, there are a lot of disabled people who are billionaires right now. You know, I have friends who are athletes, and you know, they make millions. So I mean, who's to know? So this is another thing I want parents out there to please give their child a chance. You never know. You'll never know, you know, how they're going to blossom, how they are going to rise, you know, if you don't give them the opportunity. Have faith, have trust, and just keep at it, keep at it, keep at it. That's all. That's all. And for all my friends who are disabled, I just want them to know that the sky and the sea is the limit. And if anybody tells you that you cannot do anything, you look to them and you say, oh yeah, watch me.
Lovely, lovely, Dato. That's inspiring words, and I really want to take this opportunity to thank you for giving this time today and giving us these perspectives. And really, I implore the corporate world out there to reach out to Dato and see how you can engage with this community, because it is a vibrant community and there are opportunities to do good things and build this broader community, which is Malaysia. So on that note, Dato, thank you very much for joining us, and we look forward to our next time when we can get you on the show. Thank you very much, Dato.
Thank you, everybody. Assalamualaikum.